Dr. Paul Conti.
Paul Conti, MD.
Dr. Paul Conti.
I think often substance abuse is dealt with and thought of as an illness, and in a way the responsibility is kind of taken away. I'm wondering what powers that in people, why there's such a strong synergy between substance abuse and trauma.
Trauma paves the way to substances. So it's our responsibility and for the societies around us that we don't accept the appeal of the short-term soothing.
Intergenerational trauma, so for example, the trauma of the Jewish people and the Holocaust kind of gets passed on.
Children, for example, of Holocaust survivors had higher levels of anxiety, and traumas that are perpetuated during wartime have been seen mostly through a criminal lens. But now that the conception has shifted to say that trauma can affect that person not only for the rest of their lives, but it can affect their children.
Yeah, it's quite interesting how you speak about trauma being passed on. And the way I've understood it, at least from what you say, is that it can work on a genetic level, but it also can be social. And I was wondering what you had to say about intergenerational trauma. So, for example, the trauma of the Jewish people and the Holocaust kind of gets passed on to even people nowadays. How does this work? What's the mechanism? Is it more social, or is it also quite genetic?
In the last quarter century, a field of scientific and medical endeavor called epigenetics has been really created and risen to the forefront. We've had the scientific capability now of understanding that things that happen to us can change how our genes are passed along. And it can seem as if the genetic transmission is different. So you still may get a gene, but the gene may be no longer active. So there are changes then in genetic transmission, which was really unheard of before. I mean, this was thought this is not a thing. This does not happen to us. You know, it's not that experiences actually change our genetic profile, even at the time even at the time of conception or the time of birth. And we've come to understand this in ways that are so informative. So one example is, we would see that children, for example, of Holocaust survivors had higher levels of anxiety and a higher likelihood to isolate and to not feel a sense of comfort in the world, which was thought to come through the way that children were raised, that they were raised by people who had been through such terrible experiences that they were more cautious, and that they were going to lead a child to have a sort of view of the world that was more anxious. And what we see now is that can indeed be true, but the actual genes are changed. So even if you imagine a child of Holocaust survivors who is conceived but then raised in a way that no one even knew about this, so raised separate from the parents, that child has a much greater likelihood of being anxious and avoidant, even though the child may not know the parents, right? Because the genes that are passed on are changed. And this is of incredible importance. You know, a colleague of mine named Darren Richarder, who does a lot of work with the World Court, really has been at the forefront of this, of recharacterizing. So, for example, traumas that are perpetuated during wartime have been seen mostly through a criminal lens. Like, okay, someone did something that was wrong, and then it's looked at through a criminal and legal lens. But now that the conception has shifted to say that trauma can affect that person not only for the rest of their lives, but it can affect their children, even if their children aren't born until years later, and it can affect their children's children. So we see the tremendous toll of trauma, not just on the current generation, but generations forward. And if the things we've just been talking about in the last several minutes are not enough to get us to say, hey, we need to look at this, we need to pay attention to us, what burdens of misery are we creating and passing along? I mean, I don't know what's going to get us there if this doesn't get us there.
There's this link between mental and physical health, and I sense this stigma around speaking around mental health that just doesn't exist with physical health. So, for example, my great grandmother had diabetes and then I have it, there isn't so much stigma around me inheriting that. But if we speak in the same way about anxiety, I feel like there's this need to always temper it with, going to a psychologist is always a little bit more quiet. Do you know what I'm trying to say?
Sure. We have a tremendous stigma around mental health. And I think that is because it's not understood that mental health is an aspect of brain health. Psychiatry is really a subdiscipline of neurology. We just call it neurology if we can understand the science a bit better. If we say, we can see where that is on MRI, or we can use an EEG and check those brain waves and see that why that person is having seizures. Things that we can see or understand better, we tend to call neurology. Things that we don't understand, we tend to call psychiatry or psychology. And then it seems like they're not rooted in our physical health. So it just comes from us in a way that, something that is sort of less than about us, would come like, that person is more anxious, or what's wrong with them, as opposed to there's something going on in the brain. And it's all physical health in the sense that from head to toe, this is what we're talking about. If it's brain function, no, that's still part of us. And it's part of us that affects the rest of us. So, for example, autoimmune illnesses, cardiovascular illnesses, so heart disease, risk of strokes, these are all so much more highly present when there is trauma. So we know that heart disease, strokes, autoimmune diseases, these all run so high after trauma. So it's not only all intermingled, but our mental health is actually in many, many ways deterministic of our physical health.
Drawing on that is something that Ollie and I have spoken quite a lot about before this interview, and that's the so the way in which you might reconcile the neurological perspective, which might be seen more deterministic, with the idea of agency that you're so keen on and the ability to shape one's own path. How would you respond to this seeming contradiction?
See, being trained as a psychiatrist and having some neurology training as well, the board is in the United States is the board of psychiatry and neurology, right? It also comes together. So then that doesn't seem so surprising to me. Like there are ways of understanding, for example, how our brains work when we become more or less comfortable in the world. What changes inside of us if we become more anxious, if we make decisions to say, not try new things, not try for a better job, or not smile back at the person who smiles at us if someone is interested in a relationship or in a friendship. The changes in us are brain-based. So I think of the areas of the brain that start functioning differently, the dorsolateral prefrontal cortex, the anterior cingulate gyrus. Like these are names of places in the brain, but how these places function determine, how do I feel today? Am I in good spirits? Am I looking forward to the day? Do I feel like I can do my job well? Or am I anxious? Am I worried about what's going to happen next? Do I not feel up to the task? These are huge differences in us, and they can be understood in the same way. We might assess, is that person having seizures? Well, we think they might be, but what are the behaviors that show us that? What parts of the brain might be involved? How can we understand it? It's all the same thing. Right? It's just that we are still living in the stigma of mental health and in the idea that it's esoteric, like it's some nebulous hand waving, or it's soft, it's not hard science, and that we don't really know what to do about it anyway. So no, people should just try to be less anxious, right? I mean, we would not say this if we knew someone has a huge risk of a heart attack and what are we going to do and what medicines would we bring to bear? We wouldn't say, they should just go home and try not to have a heart attack, right? But we don't understand that it's science, that it's in us, that it's part of us, and that our mental health affects us more than any other aspect of our health. So if you think about this, at least 50%, and almost surely far more, of the complaints that people bring to physical medicine physicians, so all doctors who aren't psychiatrists, right? The complaints that go to physicians, more than half come from mental health. So if you think about it, it's not that person, their stomach problems, their chest tightness, their dizziness, right? And even if they have a rash, right? But the rash is coming from stress and anxiety. More than half of what we complain about in our bodies comes from our brains. So these are very clear and obvious markers saying, hey, let's pay attention to this. It can determine not only if I'm happy today, right, or if I feel good about myself today, but if I'm sick or healthy today.
Ever shown up to the beach with a big bush, getting rejected left, right and centre, so you have to walk away with your pubes between your legs? Then get yourself a Manscaped and rule the beach. Wear your shorts with no shame. Get the Performance Package 5.0 Ultra now with a discount code LOAF to get a full 20% off, so that your baguette leaves no crumbs.
Hey guys, hope you enjoyed the clip from our interview with Dr. Paul Conti. Drop a like and subscribe for more content. If you have any thoughts, leave a comment down below. If you'd like to check out the full interview, you can click right here. Stay tuned for more.